We have 3 children, 9, 8, and 6 years old. They are constant commotion and noise and a lot of hugs and love.
They're loud, but they're perfect. My name is Renee, and this is my husband, Tom. My cancer diagnosis is stage 4 colon cancer, and thanks to the Affordable Care Act, I am no longer denied coverage because of my pre-existing condition.
There's a lot of candy to eat today, because what is today?
It's a bunny.
Yeah.
I remember the feeling, we knew we wanted 3 children, and we had our 3 children, and everything seemed perfect. And then Renee was very tired, and we thought, well, of course she is. We have 3 young children, but it kept going on. And finally, in January of 2008, she was diagnosed with colon cancer. And it came as a total shock to us. The first scans indicated a small mass in her colon, and after that, we found out it had also spread to her liver. And so we were suddenly facing stage 4 colon cancer with 3 young children.
Our world was just crumbling. For me, of course, it's terrifying, the concept of dying, but what is even more terrifying is leaving my children without a mother.
When Renee and I first got married, I assumed that I would bring her onto my private insurance plan. And I was very surprised when she was rejected from getting health insurance through the private market. And I tried 4 or 5 different companies and got the same letter back saying that because of her pre-existing genetic condition, she would not be able to get health insurance at all.
It felt wrong. You know, here I was, a mother of 3 young children taking care of this family, and I'm told for no reason that I can understand that I will not be covered for nothing that I had done other than to be born with a specific condition that led to cancer.
We were lucky enough to have a state plan in place. The problem was that it was limited to $75,000 a year maximum, and after that, it was completely out of pocket. We went through $75,000, which we quickly learned you could go through with 1 hospital stay.
We worried about every scan that I did. We didn't know how much it would cost, so we panicked. We worried if I had to do a surgery, if I had to do a chemotherapy, how much that would cost us.
Renee had to go without adequate health coverage for 3.5 years before the Affordable Care Act changed the law and pre-existing conditions would no longer be discriminated against.
The Affordable Care Act has provided me with peace of mind. When I'm not worried about the financial aspect of the cancer and the effect it has on my family, I have the space and the time to take care of my kids, to play with them, to read with them, and give them the carefree childhood that we want them to have.
I think some of the misconceptions about the Affordable Care Act are based on people's idea that it's always serving someone else. It's going to be for someone that they don't know and has no bearing on their life. And I want to say to them, wait a second, this is for you. This could happen to your family.
Your children.
You recognize it's for you, it's for them, it's for all of us.
It feels personal. It feels really personal. This actually impacts people every day. It's not just a political item. This is real. People live and die because they have health care. The only humane thing to me is to allow everybody equal access to health care. When you have cancer, anything that you can get off of your plate so that you can concentrate on getting well is a good thing. So this is a very good thing for us.